The United States Department of Health and Human Services is a cabinet-level executive branch department of the U.S. federal government created to protect the health of the U.S. people and providing essential human services. Its motto is improving the health, safety, and well-being of America. Before the separate Federal Department of Education was created in 1979, it was called the Department of Health, Education, and Welfare. HHS is administered by the Secretary of Health and Human Services, who is appointed by the President with the advice and consent of the United States Senate. The United States Public Health Service Commissioned Corps, the uniform service of the PHS, is led by the Surgeon General, who is responsible for addressing matters concerning public health as authorized by the Secretary or by the Assistant Secretary for Health, in addition to his or her primary mission of administering the commissioned corps. The Federal Security Agency was established on July 1, 1939, under the Reorganization Act of 1939, PL 7619. The objective was to bring together in one agency all federal programs in the fields of health, education, and Social Security. The first federal security administrator was Paul V. McNutt. The new agency originally consisted of the following major components: Office of the Administrator, Public Health Service, Office of Education, Civilian Conservation Corps, and Social Security Board. The Department of Health, Education, and Welfare was created on April 11, 1953, when Reorganization Plan No. 1 of 1953 became effective. HEW thus became the first new cabinet-level department since the Department of Labor was created in 1913. The reorganization plan abolished the FSA and transferred all of its functions to the Secretary of HEW and all components of the agency to the department. The first Secretary of HEW was Oveta Culp Hobby, a native of Texas, who had served as commander of the Women's Army Corps in World War II and was editor and publisher of the Houston Post. Sworn in on April 11, 1953, as secretary, she had been FSA administrator since January 21, 1953. The six major program operating components of the new department were the Public Health Service, the Office of Education, the Food and Drug Administration, the Social Security Administration, the Office of Vocational Rehabilitation, and St. Elizabeth's Hospital. The department was also responsible for three federally aided corporations: Howard University, the American Printing House for the Blind, and the Columbia Institution for the Deaf. The Department of Health, Education, and Welfare was renamed the Department of Health and Human Services on October 17, 1979, when its education functions were transferred to the newly created United States Department of Education under the Department of Education Organization Act. HHS was left in charge of the Social Security Administration, agencies constituting the Public Health Service, and Family Support Administration.